There. Hi, my name is Danny. I'm going to be a nurse practitioner student who's going to be doing your exam today.
Okay.
So let's start off by just you telling me what brings you in today.
I just had this really persistent chest pain.
Okay. When did it start?
I noticed it yesterday and it started to get kind of severe and kind of in the center of my chest. I feel like I might have a fever.
Were you doing anything when it came on?
It just kind of came on gradually. Kind of all over the middle.
So is there anything particular that makes it worse?
Well, when I take a deep breath, or if I cough, or if I lie down, it gets really sharp for a few minutes. So bad where I want to scream.
Anything that makes it better?
I noticed if I lean forward, it makes it better.
You mentioned there's times where it's kind of a sharp. Is it always a sharp pain, or?
No, mainly when I cough, lie down, or if I take a deep breath.
The time is it there all the time? Or?
Yeah, it's kind of a dull pain that sometimes feels sharp or stabby.
Where on your chest is it?
It's kind of in the middle.
Does it go anywhere else?
It kind of goes to my left shoulder a little bit.
And if you had to rate it on a scale?
Probably about a 4 out of 10, but then when it's sharp, it's about a 7 out of 10. Right now, it's about a 7 out of 10.
You mentioned the fever. Did you have any other symptoms with it?
I may have had a cold like 2 weeks ago, but I took, it went away after about 4 days. I've had a little bit of a dry cough, but it doesn't really bother me at night.
And you said it's been getting worse. Is it better or worse during a certain time of the day? What do you think it might be?
I'm not sure. I've had lupus for 20 years, but I don't think that that's it. I'm not sure.
No, we're just gonna go through some general health questions with you,
Okay.
just to make sure there's nothing that's missed that might be relevant to the concerns you're having. They're going to be yes, no questions, so you can just answer them yes or no.
Okay.
If there's anything relevant, we can go over it in a later time, but for now, just yes or no. Okay. So, have you experienced? We talked about the fever. Any chills or sweats?
Yes.
Okay. Any changes in your weight?
No.
Any changes in your appetite? Any changes in your exercise tolerance?
No.
Any fatigue or weakness?
Fatigue.
Okay. Any just overall feeling malaise or any change in your energy level? What would you consider your general rating of health?
Probably not that
Any rash or lesion?
I had a rash on my cheek.
Any bruising? Any changes in any muscles? Any changes in your hair or nails? Any changes in headaches? Any trauma to your head or bumps in your head? Any decreased vision or changes in your vision? Any blurry vision or double vision? Any inflammation or pain in your eyes? Any redness or tearing in your eyes? Any discharge from your eyes? Any changes in your hearing? Any ringing in your ear? Any dizziness? Any discharge or pain from your ears?
No.
Any bleeding from your nose or discharge from your nose?
No.
Any obstruction or congestion in your nose?
No.
Any sinus pressure or pain?
No.
Any pain in your teeth or bleeding from your gums?
No.
Any sores or soreness in your mouth?
No.
Have you had any sore throat lately?
No.
Any hoarseness or change in your voice?
No.
Any difficulty swallowing?
No.
Any lumps or bumps in your breast?
No.
Any discharge or pain from your nipples?
No.
Any swelling or change in the size of your breast?
No.
Any shortness of breath?
No.
We talked about your chest pain. Any pain with breathing?
No.
Any cough?
That dry cough.
Dry cough. And do you cough anything up at all? Okay. Have you noticed any extra sounds when you breathe at night? Any blood in anything you cough up? Okay. Any snoring at night? Does anyone you sleep with ever notice that you stop breathing at night? Talked about chest pain. Any fainting or passing out? Loss of consciousness? Any shortness of breath when you're walking or climbing a flight of stairs? Do you have any shortness of breath when you lay down at night to go to sleep?
No.
Any swelling in your legs or your feet? Ever feel like your heart's racing or beating hard? Okay. Any pain in your legs when you're walking?
No, I just have a little bit of joint stiffness, but that has been going on for a long time.
Any heartburn or gas?
No.
Any nausea or vomiting?
No.
Does anyone ever tell you that you're yellow or that the whites of your eyes look yellow?
No.
Any pain in your abdomen?
No.
Have you ever noticed any blood in your stool?
No.
Dark tarry stool?
No.
Any change in your bowel habits or in the color of your bowel movements?
No.
Any bleeding in your bowel movements? No. Any hemorrhoids?
Mm-mm.
Any difficulty urinating? Increased frequency of urination or feeling like you gotta go?
No.
Any vaginal or urethral discharge? Any drainage from your vaginal area?
No.
Any sores or itching? We talked about some joint pain. Any back pain? Any deformities in any of your joints? Any limited motion in any of your joints or muscles? Any involuntary movements or
No.
any loss of consciousness or coordination?
No.
Any memory changes lately? Loss of memory? Any changes in your speech?
No.
Have you ever had any seizures?
No.
Any numbness or tingling?
Mm-mm.
And any depression or sadness lately?
No.
Any increase in stress?
No.
Any changes in your sleep?
No.
Any feelings of wanting to harm yourself or other people?
No.
Any decrease in desire to be intimate with your partner or spouse? Any experiences with seeing or hearing things that weren't there, and any increase in bruising or any bleeding, heavy bleeding, any increase in thirst or hunger, any heat or cold intolerance, and are you able to any changes in your ability to go to the bathroom or bathe yourself? And able to any changes in your ability to do daily chores around the house? So, we're going to move on from the kind of the question portion. We'll come back to some of the concerns later, but I'm going to move on to the physical exam. Just assessing upper extremities, no bare cavities, no sign of edema. Checking here, feeling temperatures warm bilaterally. No signs of edema. I'm going to check her radial pulse here. Good. Not bounding, not thready. 2+. Equal bilaterally. I'm going to take a look at nails here, checking for capillary refill. Cap refill is less than 3 seconds. Good. And how do you just make your fingers touch like this? Okay. Got a good triangle in the middle there, no sign of clubbing. And then I'm going to move on to her neck, assessing her neckline. Trachea is midline, and no sign of any jugular vein distension, sitting at 90 degrees. I'm going to be just feeling for your pulse in your neck, all right? So I'm going to touch here, medial to the sternocleidomastoid muscle. Again, checking her rate, rhythm. Rate's approximately 70. Rhythm's normal. Again, brisk, not bounding, not thready. The other side here. Same bilaterally. I'm going to be listening to the neck now. Just ask that you not talk or clear your throat while I'm listening. Okay. No sounds of bruise or murmurs. I'm going to move on to listening to the sounds of your heart. I may linger one place or another for a little longer. That's simply because I'm a nurse practitioner student. I'm just still learning the heart sounds, all right? To start, I'm going to start with her in the sitting up position just to minimize the amount of time that she has to be laying back. I'm going to start in the second intercostal space here. On the right sternal border, listening to the aortic valve. Hear the S1, S2 sound. No S3, S4 murmurs. I'm going to move across to the second intercostal space along the left sternal border to the pulmonic valve. Again, S1, S2, no sound of S3 or S4 or murmurs, no splitting. I'm going to be moving just down here. I'm just going to pull forward a little on your top here. Moving down into the third intercostal space on the left sternal border. And then inching down along the fourth to listen to the tricuspid valve. Again, S1, S2, no S3, S4, or murmurs. And then I'll just have you kind of lift up for me if you can, going into the fifth intercostal space here at the mid-clavicular line to listen to my mitral valve.
Well, you used to smoke, but you don't smoke anymore, so that's good. How many times you smoke?
And I'm going to have you lean forward for me just a little bit. Also take just up top here with my diaphragm, listening for any aortic murmurs, again in the second intercostal space, right sternal border. Also in the second intercostal space on the left. And then I'll switch to the bell as well. Again, S1, S2 are present, no S3, S4. All right, I'm going to have you rest back now. Again, I'll be listening and starting in the diaphragm, in the same spot locations, second intercostal space on the right sternal border. Second intercostal space on the left sternal border. Just the pulmonary. And to the tricuspid. Yeah. Sternal border. For my mitral valve. Yeah. Gently touching your chest and over the rise and falls. I'm palpating down for any lifts or fills.
And then later, yeah. This is for the final. So this is how I can understand what this is.
Have you lift
So this is
finding
and I think what's it called?
point of
So it was in week one.
fifth in intercostal space, mid-clavicular line.
welcome to go with yeah, it's like the black. I haven't seen the black.
I brought my book at work, and one of my attendants was like, I think I read the second edition of that one. Yeah.
My first one is the 4th edition, you know. I'm like, wow, 12th edition. Well,
S1, S2.
yeah, it's big cleat, you know.
This was my Bible when I was going to school.
Yeah. I'm really glad we switched. I like this so much better. So much better. Oh, just put it on
Over the age
the
of
dead on
50,
the
I will check for the abdomen, check the abdomen for any aortic masses, but seeing as she's under 50, I won't be doing that in this assessment.
All right, ladies, have a great.
Yeah, you're going to be checking your legs, okay?
So you'll let me know. So, I mean, it would be nice to meet
Feeling for the moral pulse.
or something, or just talk about
Not rounding out already, about 2.
with the AG.
Lift your leg up a little
Oh,
bit.
okay.
Kicking
Okay.
it up.
Yeah.
Okay. All right.
Okay, thanks so
Not
much.
heavy, not rounding. Not too close. So just checking the dorsal piece. Not spreading, not bounding, about 2 close on the posterior tibialis. Again. Similar findings. I'm just looking at temperature, warm bilaterally. I'm just going to check for any tenderness in her legs. If there's just bend slightly at this knee for me. I'm just going to touch your calves here. Does that feel alright? Any tenderness? No, that's fine. Again, check on this side. Any tenderness there? No. Another patient I would check for varicosities, and no signs of edema here. Check the femoral on this side. 2 plus. Just gonna help us here. Founding or Freddy. Present. Alright. So that completes our assessment for right now. You can sit up if you like. Do you have any other questions or concerns at this moment? Alright. Thank you.